again, Ianessa. It's so wonderful to speak to you again today.
Thanks, Katrin. I'm excited to talk to you again. We had such a great reception from our first discussion that when you suggested that we talk more, I was like, absolutely.
Yeah, I love that we're continuing the conversation because there were questions that came out of our conversation about vaginismus and swallowing,
Yeah.
and specifically about the gag reflex. And this is what I'd love to dive deeper into with you today. You are a wealth of knowledge about what it is, how does it work, and what can we also do to gag less?
Mm-hmm.
So first of all, how did your work around the gag reflex kind of come to be in relation to any sort of context of life, but maybe also you want to share about the sexuality space?
Yeah, so I essentially study the opposite of a gag. So a swallow is physiologically the opposite. It is welcoming and accepting something into your body. The gag is essentially the reverse of that. And the reason I know about the gag is for two reasons. One is there was this time where misguided clinical practice meant that if you wanted to know if somebody could swallow because they are admitted to the hospital with a stroke, for instance, we know stroke is one of the many things that can cause significant swallowing problems, they would just try to gag you. And if you had a gag reflex, then your swallow must be fine. That's like saying if you can cough, you can certainly sneeze. They're two different things. Yes, they're similar in protecting your respiratory system, and they use similar structures, but they're not the same thing, right? So that's why I know about that, because we had to do a lot of work as a profession and as scientists to dispel that myth. There are still people who go around gagging patients to say, oh, their swallow must be fine. But the other thing is, in order to understand the physiology for swallowing, I became really passionate and interested in all aspects of the structures involved in swallowing, be they for a swallow or for a gag. Now, how it turned into my knowledge related to sex and sexuality is because I work very closely with my best friend who happens to be Reba, who we talked about before, Reba the Diva. She's CEO of Sexpert Consultants, and she's the chair of the Sexology Summit, and I'm co-chair. So her areas is sex and sexuality. My area is swallowing. And upon talking, she told me that in her fellatio workshops, for which she has like one of the top workshops in DC on that topic, the biggest complaint that people have when they're providing fellatio is my gag reflex is a huge deterrent to actually performing something that I want to perform in a very particular way that pleases my partner. And so when I heard that, she told me that some of the things that people are doing to suppress the gag reflex were frankly medically concerning, right? And so we ended up talking more about that. And so that's how I ended up coming into knowledge about the gag reflex, both from a basic physiologic standpoint to a clinical standpoint, all the way to now a sex and pleasure standpoint.
Mm-hmm. Yeah, people have the desire, people have the want to provide, to give fellatio. All of the puzzle pieces are there, yet the body doesn't cooperate. And this is very much the story also of my work with guiding women and vulva owners and overcoming vaginismus. And the example that you used about, the cough and the sneeze not really being the same thing reminded me of basically the expectation that if you can give birth to a child vaginally, that also means you can insert something into the vagina. And that's totally not the same thing.
Yeah.
So it's kind of interesting to make
That's
that
a good point. That's a good point. Like it's the coming in and going out of, right? Like your body wants to get rid of this parasite. Frankly, I've had 2 kids and my body was like, you got to go. You hear me? There's nothing I do to keep the babies in. It's like, go. So it's very different.
Yeah. And in my work, that vaginal delivery is very much the reflex that is designed to function without any thought, without any intention or any quote unquote work that has to go into it.
Right.
So many people who can give vaginal birth do still experience vaginismus, but they give vaginal birth relatively flawlessly. So that's good news for many people out there.
Yeah. Yeah. So what questions do you have about the gag reflex? Where should we start?
Let's start at what a reflex even is. I know you have a series on this on Instagram, so for a bit more of a visual representation, I invite people to check out your page, Ianessa Humbert. But tell us, what is a reflex?
Yeah, so a reflex is essentially a physiologic protective response that your body has. We are born with reflexes. Babies essentially are just balls of reflexes. They just constantly, just a series of reflexes happening all the time. If a loud noise happens, they go like this and they scream. If you put something here, their rooting reflex means I must suck this. They are reflexes because their cortex is not developed enough for them to make volitional decisions about things. Their body is just, I want to survive right now, right? So then we lose a lot of reflexes in order, because our brain now can manage things, right? That from a cortical sort of higher center thing. A reflex is essentially a protective behavior where it requires a sensory stimulus to trigger it. So with a sneeze, it can be a particle in your nose. With blinking, it could be something coming close to your eye. With gagging, it could be a foreign object that might choke you. These are protective reflexes that are triggered when there is a stimulus that goes into your central nervous system to say something could happen, and a cascade of stereotypical hard to suppress behaviors basically happen. So a knee jerk is when your patellar tendon on your knee is stretched and a kick happens. So that sensory information that something hit your knee and that stretch happens goes into your spinal cord and says, please display these series of behaviors, these muscle contractions, which lead to a knee kicking or your leg kicking, right? So what you have to have is you have to have that reflex arc. Sensory information goes into the central nervous system, and a stereotypical hard to suppress series of behaviors are sent to muscles to do something. That is the basis of a reflex. A swallow and a gag are more complicated reflexes than something like a cough or a knee jerk, as an example, right? And that's because you can cortically suppress them a little bit differently. You can modify them differently. And you can even think your way out of them, and so to speak. When I say cortically suppress, it's like, I'm not going to gag, don't think about that. It's really hard to do that with a sneeze, right? If you really have to sneeze, you can be like forever, but you can't eventually just be like, I'm not going to sneeze. Sneezing's not going to happen for me in life, right? So that's an example of how your brain can be involved in modifying it.
Right. And the brain could also, I imagine, be the catalyst if you're thinking something gross that would otherwise make you gag. You're kind of creating that reality for yourself.
That's what's interesting about gag, and I'm so glad you said that, is that gagging is so unpleasant that even though the lower centers of our body, the lower parts of our body that do a bunch of reflexive things, they are involved in making it happen. The higher centers take stock of what just happened. I hated that experience. And now they become innately involved in it never happening again, which means I never want to see that gross rash on a body again. I don't want to gag. I never want to smell that. I don't want to ever taste a banana. Oh, that texture is disgusting. I can't do eggs. It makes me throw up. So now your brain is involved in stopping it before it starts. And sometimes it's its own curse, because now you're thinking about it, and you can, in fact, induce a reflex like a gag by thinking about it and not having the sensory stimulation anymore that's physical. Now just thinking about it can do it. Think about things like anxiety, right? Like those things that happen quickly. You're like, oh, I think I may have mass produced that in my brain in the absence of any real threat. Gagging is one of the few reflexes where you can do that. I can't suddenly make a real sneeze. I can fake a sneeze. I can fake it, but it's all faking. It wasn't the real, actual, factual, eyes watering, tongue out, real gagging experience. And unfortunately, the brain is so powerful that we can elicit it when there's no physiological thing, or we can subdue it in the presence of physiological things.
Mm-hmm. The brain is really so powerful, and it creates a self-fulfilling prophecy. It is that perceived threat in here that then makes the reality out here through behavior. And that's so interesting about the gag. It's so interesting about vaginismus as well. When it comes to the gag, there is healthy variation in how people experience it, right? We've got hypersensitive reflex on that and hyposensitive. Can you tell us a little bit about that? What would the hypersensitive look like, and what would the hyposensitive be like?
Yeah, hypersensitive essentially are people who gag with very little stimulus to gag. They're about to brush their tongue and they can't even really brush their tongue properly. They can't even go to the dentist because the thought of having anybody in their mouth, even touching their teeth, where there is not even a real threat to their body, Like there's not a foreign object that's going to go down there. There's just the perceived thought of a foreign object, and they're gagging like crazy. A hyposensitive person would be some people just don't have a gag, or it's very difficult to elicit one, right? So those are the ranges. And most people are somewhere in the middle. The only way to know what the middle is to know what the extremes are, right? Like I'm neither the person who can barely go to the dentist, but also you can't go putting a fire tube down my throat into my stomach and I'm like, feels good. You know what I mean? Like I'm neither of those, right? That's an example of one. Now, that may be your baseline behavior, but in addition to that is there are people who have superpowers in modulating whether they're one or the other under certain circumstances. Right. So there are people who have, okay, this is the time of the month for me where everything makes me grossed out. Right. So I'm going to put these things in place so that I can enjoy this week because I'm going out to vacation and I want to be able to eat these foods, but hormonally, this is a tough time for me. So they can modulate in advance and prepare themselves and go from hypersensitive at this hormonal time to reasonable. Right. But people can also do the opposite. Maybe they're basically can be regularly hypo, but they're like the dentist, I'm freaked out. And now everything's bothering them. They can't even brush their own teeth that morning before going to the dentist at the thought of the dentist, when last week when they weren't thinking of the dentist, they brushed their teeth just fine. Right. So it's not just what your physiology dictates, it's also where your brain is modulating that. And they're sort of doing this and you have to keep track of all the things.
Yeah. And I guess that means you can probably not become a sword swallower if you didn't have a hypo sensitivity right away, but there is that healthy variation between the two extremes.
That's right.
And I love that you bring up hormones too, because I imagine we see that sensitivity change during the menstrual cycle, but also specifically during pregnancy. Have you noticed that pattern?
Yeah. I mean, everybody who's heard of pregnancy thinks about the typical stereotype of morning sickness, right? And this idea that there's nothing other than the morning time. Like the morning was enough. I've had so many mornings up until now, and now morning makes me sick. What the hell, right? And that is a true hormonal, physiologic, intrinsic difference that makes you really just disgusted, right? And so, I mean, that happened to me. I wasn't even really that bad, but I do remember thinking, why is everything gross? Why am I smelling the neighbor's strawberries right now? And I want to throw up. Like, what is this, right? And so, yeah, absolutely, all of those things can play in. And there are times of your life or times of the year or times of the month or times of the day where you tend to be more sensitive than others. And there are also conditions under which what you want to do sexually butts up against what your body can tolerate, right? It's that mind-body interference or disagreement that we talked about before with vaginismus, which is my body wants to take this in and it can't. And the same thing with gag reflex.
Yeah. All right, so let's talk about how we can create change in our current experience of gag. I would love to first start off with the things that you do not recommend that we do, because there's so many tips and tricks. Using of numbing cream as one example that can be damaging. So right off the bat, what are some of the red flags in terms of recommendations out there that you would advise against?
Yeah, what I would definitely advise against are using any topical anesthetic that you're swallowing. And here's why. Your nerve endings for sensory information are really important in your head and neck. If the tip of your finger goes numb, as an example, because you keep dipping it in some kind of numbing cream because you're a seamstress and you hate getting pinpricks, right? And after a while, they don't work anymore. Is it damaging? Yes, it's problematic. It's problematic. But in your neck and in your throat, there are so many reasons why you want to be able to feel things, anywhere from I swallow food, it's actually stuck there. I can't feel it. Now it's falling into my trachea. But because of years of swallowing numbing cream so that I could provide superhead, now I can't even tell where anything is going in my neck. Those are really significant problems that you don't want to have. Now, mind you, I'm a proponent of, if you make a decision that actually I really don't care if I end up with choking incidents and pneumonia, because giving amazing head is what matters to me, and you're making an informed decision, just like anybody else, smokers, those kinds of things, they actually do numb your throat as well. In research studies, we can't include people who are smokers or heavy drinkers because their capacity to feel things in their neck doesn't match people who we expect have not had that experience. So a lot of things are actually impacting your sensory experience down there, but adding a dedicated agent that goes out of its way to numb your throat can be problematic. That to me is the biggest red flag.
Mm-hmm. Thank you for sharing that. I had no idea about smokers and heavy drinkers. Yeah, it makes sense. Those are numbing agents also, not only physically, but emotionally, mentally, spiritually. And numbing cream is something that vulva owners, vagina owners consider also in overcoming vaginismus in order to remove all sensation, and that could lead to long-term damage, short-term damage. But like you said, making an informed decision is what matters most. So
yeah, and I just want to say, it's not that the smoking and drinking numbs it, it's that the nerve endings become damaged over time.
Okay.
Yeah, from being exposed to those that material, that toxin, those chemicals. Yeah.
Right.
So that would be very important, that you are able to maintain what I would say is anything that at the level of the physiology we're talking about, not the brain, anything that you're doing to your mouth and neck, to those tissues, to say stop working. I don't like the idea of that might be irreversible and impact other functions that you want to work. At the level of the brain, however, we have way more control. And if we are able to distract ourselves or reconsider the situation such that our body responds differently, and we can modulate the context under which we want the gag and the context under which we do not, that to me is a more powerful and functional way to modify the gag. And here's an example. One thing you want to do is ensure that your arousal level is high enough, right? Just like with food, you can have the most amazing dish of food in front of you. That's something you've always wanted, but you're not hungry.
Right.
You're really, really full. It's so much harder to force down that delicious food because you're like, oh, I just ate. You made me this amazing meal. I have to wait until I am aroused, until this is palatable, until my appetite network is high, right? Same thing with arousal. If you kind of aren't really into it, it's going to be harder to suppress that gag. So one thing is making sure you really want to be there, you're enjoying this, and there's nothing more than you want this experience, right? The other thing I would say is let's really think about what we're saying when we gag, because there are positive aspects to gagging and there are negative aspects to gagging. The positive one is twofold. One is the idea that physiologically, you actually produce a different kind of saliva when you're gagging. It's not the more thin fluid version that's in your mouth that feels like water. It's actually a much more viscous version. And that actually aids in sexual activity because it acts as a very nice natural lube. Think of Uber lube, except you made it out of your body. It's pure organic, right? And so you know where it came from. And it rushes to the site of need at when it's needed, like it goes right where it's needed. And it can actually aid as a barrier to feeling that sensation and adds the lube that you need. And then psychologically, if your partner's into it, sometimes the partner might be excited by the fact that you gagged here and there because it's like, oh my God, my penis is so large it gagged, this person gagged, that kind of thing. There's that kind of excitement. Sometimes it can work in favor. And that's what a lot of couples have said, that actually I don't mind gagging a little bit because it gets my partner excited, but also I get a nice lube there. And it feels like we're engaging in this together and our bodies are doing what our bodies are doing. So there's a psychological component of, I really want to be here. And two, if I gag a couple times and we understand each other's bodies, it's kind of nice.
Yeah.
When gagging is a problem is when it literally interferes with your capacity to enjoy it, or you actually think you're going to throw up. You have acid reflux. You have all these other things. Your eyes are watering. You literally cannot continue. That is when we start talking about things like distractions, right? Or also things that we do that are sort of like liquid courage, right? Sometimes being a little bit high or being a little bit under the influence of alcohol, not to the point where you can't consent, but to the point where you're more relaxed and you're not hyper stressing about gagging, that can alleviate some of the stress around gagging or the anxiety that you might gag. There's also focusing another part of your body. Like if you're focusing on curling your toes, well, if you can coordinate that and, providing the sexual pleasure that you need to coordinate, right? There are other things that you can focus on. There's also adding taste. to the experience, making your body not think of it as a foreign object that you can choke on, but rather maybe a popsicle that you're licking something off, right?
Right.
If you think of it, making it more functional, like my body knows how to take in food in good taste, and it distracted me. So it wasn't just this object that I would never swallow. That can help.
I love, love, love that you started with a conversation on when is it actually a problem? It's when we don't enjoy the experience or it inhibits us from having full desire be present and enjoyment be present, because that relationship to the gag is so important to establish at first, right? It can be a turn on. Oh, it can provide lubrication, and it can actually show me that my body is functioning the way it should be at this moment. And hence, feeling like all of the above scenarios happening are all normal is a really nice way to make friends with this body response. So great. And distractions, taste are all beautiful ways, beautiful little tips to incorporate. In terms of other forms of distractions, you said curling the toes. I've seen like putting pressure. Somebody said on your left hand and your thumb. Do you know if
Well, I mean, it's really just the thing is you might be using your hand, right, during this thing. So it could be the case if you feel like left hand somehow magically works for you, that's fine. But, left hand, right brain, that's fine. But everything in this region is bilateral in function. It's not like your limbs where your right side primarily controls the left and the right. Anything that's midline structures are provided innervation to these muscles bilaterally. So you're not really turning off, oh, my left gag is off because you know what I'm saying? I wish it was like, electrical engineering where I can say, oh, that part of the house, the panel's not working, the fridge isn't working, but the toilet works, something like that. It doesn't work that way. But what's important is that they have found something where they have said, whatever your brain things works. Left hand, thumb in, tuck the fingers. That works for you. Do it. If you're like, but how do I use my hands in this? I need to hold myself up or whatever it is. Then think of something else. It could be curling your toes. It could be arching your back. It could be anything that you're taking your brain off. You're adding to the sensory information going to that your focus isn't on, oh my God, I'm going to choke. And I also wanted to say, we're talking specifically about fellatio, but I want to let you know that many men have complained, and I'm saying men intentionally, about giving cunnilingus to a woman that they're kind of grossed out by it, but they won't really want to admit it because they want to make her feel badly, right? Everyone understands anything probing your neck, man, woman, boy, or girl, is a stimulus for it. It could be your toothbrush, a dentist, or a penis. But there is some reticence to admit that I'm kind of grossed out by cunnilingus. And as a man, I'm supposed to be able to do these things and not be grossed out. I don't want to be gagging down there because something's probing me. It's the concept of it being gross. And it's the same idea. It's really the mental hurdle in that case, not a sensory stimulus that's actually probing any place. Because if you're eating watermelon, you know what I'm saying? In that case, suddenly it's not gross, right? But when you're eating pussy, right? Now it's like, oh, it's just the whole anatomy and the smells and all the things. And that's okay. I'm just here to say it's okay that you're grossed out by that. Guess what? There are strategies for everybody. For the most part, I think probably 80 to 90% of the people, there are strategies. Now, when I say strategies, I don't mean cures. I mean strategies so that you can, and a strategy might be, hey, there are other ways that we can find enjoyment where I can use my mouth. It just might not be in this exact way that we're talking about, but let's find other ways. That is still a strategy. The goal here is pleasure at the end of the day, not necessarily pleasure in just this particular way.
Mm-hmm. Consensual pleasure at the end of the day is what we're looking for. And I love that you bring that this is a challenge that people of all genders can face with any sort of activity, anything that we find for one reason or another gross. That creates that psychological relationship of like, oh, I'm a little bit disgusted, a little bit put off by this. And I find that as a society, I speak from my own personal self, I have a background in history of feeling like this is kind of gross. The shape of the penis was also subconsciously scary for me. There have been associations to genitals that were never celebrated and healthy in the way that we were brought up to explore our bodies. Yep. So it is no surprise that people all around the world of all genders can also experience an uncomfortable or unwanted gag or
Mhm.
any other sort of psychological thoughts that will create the situation to be less pleasurable.
Yep. Yep. And I think as we sort of encapsulate everything, I think what we're saying is understand your body and understand your body is doing things that it's supposed to do in a sexual or outside of sexual realm. These things, you were born with these reflexes and these responses, and your body's not wrong for it. But you, once you accept your body, you'll get a chance then to say, I accept it, but I also am in charge in a lot of ways that I might not have been understood. And so rather than trying to change my physiology by numbing things, maybe what I can do is change my perspective by reorganizing the way I view things. And if for you, it's like, I do better with any kind of oral sex when we both have just had a shower. That's such a simple solution. And for me, adding a little taste lube down there really helps me. There's nothing wrong with that. But until you accept your body and say, I'm going to power through this, I'm going to power through this. It's like, I don't have to power through this. I can find a strategy that my body likes, and then we can both enjoy it. To me, I think that is the most healthy way to approach things.
Yeah, I love that. Taking our power back. Well, that does encapsulate everything so beautifully. Is there anything else on the topic that feels relevant for you to share? Any other message related to gag or pleasure in general that you'd like to share?
Yeah, the last thing I want to say is that you and I are going to be on a panel in the Sexology Summit next week. It's an Ask Me Anything panel, and it really is about interacting or integrating medicine where someone like me understands the medical aspects of this, but only because of my friend did I really understand the pleasure and sexual and social issues around our bodies in that way, right? And so I would like for people to really be clear that the medical world is not where they should be in having these conversations. I can tell you right now, most speech pathologists don't know how to have this conversation. I can tell you right now, my experience with OBGYNs, the likelihood that they could explain this and talk it with zero yuck factor surrounding all the things we talked about without the pressure of liability or billing, et cetera, it's very low. It's very low. So it is really beholden upon each and every individual to understand that if I don't do the work to understand my body and take what I can from all of these constituents, the medical people, the sexual health people, the people who told me what I should believe about myself, and make my personal decision about what works for me, then you may always be in a place where you don't quite get the pleasure that you want, or you might engage in things that hurt your body that then you're ashamed to talk to about your medical provider later. It can be a bad cycle of things. So you really have to be okay with yourself and your body and what you want, and understand that people just need to get on board or get out. If you have a healthcare provider who can't get on board, you might need to find somebody who can, or supplement that person with someone in the sexual health realm who can do that for you. They might not understand each other's world, but you're the person in the middle who has to take the parts that you want, just like a buffet, right? And leave the parts that don't work for you.
And that is exactly why I'm so grateful that we're having this conversation. Thank you for sharing your insights, your expertise, letting people know that their experience of their body is their own, that they can take back control, and they deserve to. They deserve to have all the pleasure they desire.
Yeah. Thank you, Katrin, for talking to me about this. The questions you're asking are so relevant to most people, even beyond vaginismus. Vaginismus is the thing that brought us together in terms of the concerns that you had, that you wanted to talk about, and the curiosity I had. But ultimately, this extends to almost anything that somebody could be thinking about for their body. So thanks for being willing to talk about it too.
You're very welcome.